intensive care in particular, because that's a lot of what we do in cardiac surgery. So, training in those particular fields is always a plus. But really it's kind of the attitude also.
Today, I'm so excited to be chatting with Tim Hansen, Chief Cardiothoracic PA at Stamford Hospital. Nice to have you with us today, Tim.
Thank you so much for having me.
So let's start with your journey to PA life. Tell me what that was like.
Well, like many PAs, when I was in college, I didn't know so much about what a PA was, especially, not to date myself, but I've been in the field for a while at this point. The field, back in the early 2000s was sort of blossoming at the time. It's been around since the 1970s. PAs have been, working and doing great things since the early 70s. However, it took that long to get things really, really moving. And so when I was in college, I really was focused on pre-med classes and exploring med school, preparing for the MCATs, and didn't really know so much about what a PA was. I had a break between college and applying to postgraduate schools where I worked doing as many things within medicine as I could, doing some volunteering, getting some experience. I worked in the med school, a department of the med school at Yale, to really just talk to people and see where to go from here. And I was talking to a clinical advisor there who just happened to be working, in the department. And she said, "Have you checked out the PA profession?" And I said, "No. What is that?" And, so really kind of went into research for myself and, discovered this amazing field that I thought would be a perfect fit for me.
Fantastic. And so did you know early on, you've, been in cardiothoracic, the cardiothoracic area, I think most of your career.
Yeah, my whole career. Right.
So did you know early on that that's what you wanted to do?
Pretty early on. I think a lot of PA students, it's a grueling sort of process going through PA school. It's a pretty intense couple of years. Usually most PA programs are 2.5 years or so. And, a lot of it, the first half is all classroom work. And it's, just the daily grind of learning. And a lot of that stuff the pre-med classes don't really prepare you for. This is, a lot of physiology, a lot of pathology, pharmacology, all this stuff you're being exposed to for the first time. So it takes really getting into your clinical year where you're doing rotations at hospitals and through different services to figure out, what do I want to do, within medicine. There's so many fields that PAs can work in. The options are endless. Mm-hmm. So I initially thought, I love kids. Maybe I'd want to be in pediatrics, and I ended up moving completely in a different direction and went for cardiothoracic surgery. Mm-hmm. But that process was, for me, I discovered what I liked and didn't like during my clinical rotation year.
Mm-hmm. So it sounds like, if I'm kind of going back to that college era for you, that you were, pre-med, thinking of MCATs, medical school. What were you thinking at that point where you decided to make the shift to go to school to become a PA?
Well, it's very overwhelming. Just the application process for any postgraduate career is daunting. Obviously, schools are super competitive, and requirements change, and I had to take some classes after college just to get the the required, prerequisite courses that I needed to apply. So it's certainly it's not easy, especially when you don't even know exactly what you want to do. I just knew I wanted to go into medicine. So when I was able to focus on the PA profession and looking at specifically PA schools, and I traveled around to a few different parts of the country to both look at schools and to interview, it got a little bit easier. The focus was there. I knew what I wanted to do.
You had your plan.
I had a plan.
Right.
It was coming out of college. You don't always have a plan, except to know that you want to do something. Mm-hmm. So it was nice to find that plan.
Mm-hmm.
Yeah.
And so you finish your PA degree, and now you're, beginning your professional life. What was that like for you to kind of get to that other side? Obviously the degree you needed, but what was it like for you personally to kind of get to that other side of you starting your professional journey?
Well, it's very satisfying. You go through sort of, I don't want to say 2 years of hell, because it was, a lot of it was fun also, but it's hard work. And once I did find my focus again, even further after, deciding I wanted to be a PA, then finding that focus during my clinical year to say, wow, I really enjoyed this cardiology rotation. I really enjoy heart physiology. And then, I really enjoyed this surgical rotation too. Mm-hmm. You start putting things together, which, helped to evolve into a career for me.
Any memorable bumps along the way?
Yeah.
I know you said it was fun, but it's also hard. So
well, it's really just the stress of needing to perform on a daily basis. During the didactic year, it's tests every week. Mm-hmm. And that you're kind of used to that. I mean, for me, I was not too far out of college, so I was still in the mindset of studying hard, taking tests, being evaluated in that way. The PA career is a lot of times a second career for people. So I looking back, it's hard to imagine how some of my classmates, who were embarking on this process later in life, it must have been much harder because you're not in that classroom focus. So the classroom part of it was something I was used to doing, but then getting to the clinical side of things where I'm going through different hospitals, you're a student, but you're expected to perform. You're expected mm-hmm. to, be attentive and be eager to learn, even if it's not something that you're totally interested in. And you're actually dealing with people. Mm-hmm. It's not just mm-hmm. a book. You're not taking notes. You're not taking tests. You're dealing with patients.
Mm-hmm. What do you think those second career folks were thinking as they're sitting across from, a young buck who just, is kind of traveling right along that path right into PA school?
Well, they're probably looking at me like, I'm this college kid, and they have actually had real world experience doing something, whatever mm-hmm. that might have been. But in PA school, we're all in the same boat. And we all have the same goals, and I think the only way to get through is to work together. Which, mm-hmm. A lot of PA schools are smaller in size, class-wise, so you get pretty close with your PA, colleagues.
Cohort. Yeah.
Yeah. Mm-hmm. Actually, I married one of mine.
Oh, so. So there you go.
And that's a common story. And
yeah.
Actually, I know a lot of people who have, met their life partners while they're creating their career. So it's funny.
So let's chat about some of your experiences, because you've been, evaluating PAs, looking at resumes, hiring for lots of years at this point. Let's talk about the interview process, starting with the resume review. Take me through how you do it from you get that resume and kind of talk me through that decision-making process and kind of into the interviewing phase of the evaluation, if you will.
Yeah. So when I receive a resume, obviously the first thing I look at is experience. Where they're coming from, what they've been doing recently. For a new student, it's hard, coming out of school because you don't have that experience, but you do have interests, you do have consistency in what elective clinical rotations you may have done. You may have even consistency dating back to before PA school, where you worked as a paramedic or an EMT, or maybe you worked as a technician in the emergency room. So I would be looking for, if I'm hiring in cardiothoracic surgery, I'm looking for someone who has interests that are consistent with the skills that we would be looking for, and the specialty itself.
So what's an example of something that a new grad can put on their resume that you're going to kind of zone in on and be like, yeah, that's what I need to see?
So for a new grad, I would be looking for someone who is obviously outgoing and eager to learn. I'd be looking for, a specific interest in either surgical fields or intensive care in particular, because that's a lot of what we do in cardiac surgery. So, training in those particular fields is always a plus. But really it's kind of the attitude also, which is hard to express on a resume, but especially in the interview process, when you get to that point, the interview, I feel like it's not only an interview from my standpoint, it's an interview from the candidate's standpoint as well. It has to be the right fit. Mm-hmm. And that fit is going to determine the success of the overall picture.
Yep. So let's talk about that a little bit. So you've given some insight as to what new graduates can get on their resume to entice you or make you interested. And now you've gotten into the interview phase. So let's talk about that. What's your style? What are you looking for in an interview?
Well, I feel like I'm a pretty laid back kind of guy. So I try not to be too intimidating. I want someone to relax. I want to see, what they're like when they're comfortable. That does two things, I think. It may provoke them to let their guard down a little bit, which is something I would be looking for. I don't want you to be too relaxed, but I want you to be yourself.
So what are some of the questions you might ask to, maybe in that initial kind of like, let's get you relaxed phase?
Yeah, I want to know, what they're looking for in a job, what they're looking for in a specialty, what they're looking for in a team to work with. Mm-hmm. One of my biggest pieces of advice for PA students who rotate through our service is to look for a position that's, that has an established group. It's very well understood that when you come out of PA school, you're not going to hit the ground running. You need a year, 2 years, sometimes more to continue your training. There are residencies for physicians. Mm-hmm. There isn't really a residency for PAs unless you're interested in. Specifically, there are some surgical residencies that have come up, but it's not a requirement. So the first several years of your career as a PA, you're still in training, and you want to go into a situation that's going to set you up for success, which, in my opinion, is a place that has an established team or group that has PAs and APRNs that are already there. That can do that training and can sort of assimilate you to, actually treating patients.
So what could a new graduate student do to get that research done and make a determination? Is this the type of established group that's going to be good for me? What should they be doing?
Well, the job description will tell you a lot. It'll tell you if it's a startup kind of program. It'll tell you if it's a large hospital service. Then you're pretty much sure that's going to be, a big hospital is used to training. Whether it be residents, new PAs, those are always good opportunities because you get a lot of experience very quickly. So that's one thing you can certainly look at the job description and figure that out. But I think it just sets you up for success, to have a place that knows your role and understands that, you're a new graduate. You're going to need some time.
Mm-hmm. What type of questions could they ask too? Because, maybe it's in a large established teaching hospital, but there's a new chief of surgery. So what kind of questions should a new grad be asking during the process to kind of get the information they need while also presenting themselves in a good light that shows their...
Yeah, I think the most important thing is to appear eager and outgoing. Like I said, if you're willing to learn, people will be willing to teach you.
What does that look like in an interview? How do you know this person's going to be someone who's going to want to continue to learn?
It's really just being excited about where you're trying to go. If you're applying for a position in internal medicine, you should be excited about, seeing patients on a daily basis and, with a variety of different medical issues that may come up. If you're interested in a surgical position, you should be really excited to get into the operating room. And I think you can make that clear in an interview without being too, overpowering or overconfident.
Mm-hmm. What do you think, and I'll give you a minute to think about this if you need it. Over the years, you've interviewed probably hundreds of candidates. What do you think the best question you've been asked on an interview is, coming from the other side of the table, coming from the candidate side?
I think it probably has to do with how the PAs function as a group, the teamwork and the expectations. For instance, how would you guys, if somebody were asking me, how would you guys manage this particular patient with regards to, discussing with consultants and other surgical specialties? And it's because it's really a team effort in most cases. So if somebody were coming into a field for the first time, like what does that look like, and what are our expectations within this team?
What's interesting about that is normally you're hearing the person who's doing the interview giving a clinical scenario, but it sounds like that's a great point. If they're asking you about it, that's a kind of
it just shows interest. Mm-hmm. It shows that they care about the team dynamic. So I
love that.
Yeah.
I want to go back to something that you said earlier, and I hadn't thought about this, so I'm really excited to hear what your take on it is. You're talking about getting that new grad that's coming in, or the person that's coming in to interview with you, talking about keeping that guard up. Mm-hmm. And sometimes that's not good because you're maybe not getting a sense of who they really are. But then there's also the flip side of that, which is getting your guard all the way down, and that could lead to a whole host of traps as well. So tell me a little bit about that whole kind of keeping your guard up kind of scenario with candidates.
Well, you have to be on your game. You have to be ready for anything, ready to be asked anything. So there is a level of sort of heightened, I don't want to say anxiety throughout the course of an interview process, but you're going to interview with a variety of different people, right, and you have to sort of know your audience a little bit. I think some interview processes are designed to, get the personal side of you as well as the professional picture.
tell me a story of a candidate that let their guard down too much. I'm sure you have them.
I mean, I've been lucky that I haven't had any terrible interviews. You know, we at our smaller hospital, we hire a lot of more experienced PAs. So I'm seeing people who are, you know, great candidates, well qualified. But, you know, you can tell sometimes if somebody is maybe not the go-getter, not the hard worker.
What does that look like?
Well, it's, you know, if you ask them about how they dealt with a particular situation, you can tell they were sort of, you know, maybe a little bit aloof, or they let somebody else, you know, take care of things. You want to portray that you're going to be in it with everybody else and doing whatever's necessary at whatever cost, kind of thing. So, you know, it's about being yourself, but not, you know, being overconfident.
What's the toughest question you ask on an interview?
I like to ask about how you would deal with a particular patient who's not doing well. You know, if you've had it, and everybody's had a patient that's sick, and you know, not everybody does great and leaves the hospital. So how would you deal with a difficult situation?
And how could someone answer that in a way that tells you that, you know, they're on the right track? This is someone we could be working with.
Well, you know, they have to have an approach that is systematic, that is, you know, they have to know their limits, so they have to, you know where to go when they need additional help. I would be interested to hear about how they, you know, dealt with the family, because that's always very difficult as well. Their communication skills, either with other team members, other services, family members, that sort of thing. But you know, the skills need to come. You know, they will develop. It's about how you approach a problem, I think.
Mm-hmm. And what are you kind of thinking when they are giving you that answer? What's going through your mind in terms of evaluating?
I would just I like to see someone who's confident but knows their limits. You know, who has a systematic approach to a problem, but knows what to do if that approach isn't working.
Let's talk about another hugely important piece of the interview process, and that's red flags, you know, that make you say, I need to be maybe a little bit more cautious about this person. Mm-hmm. And then we'll talk about some kind of green go-ahead flags. But what are some of the red flags that might come up during an interview for you?
I think maybe a red flag would be an applicant who wants to be in this particular field but has no, you know, background evidence for why they would want to be there. You know, maybe they're just looking to get in the door somewhere and, you know, plan to leave in 6 months. That's not what I'm looking for. So some sort of track record to say, yeah, this is why I'm interested in this. You know, have a statement that shows how you're excited about this particular field, or the physiology that goes along with it. Or maybe I'd be looking for a story for, you know, why they got into that field, or why they want to interview for this position.
What else might they ask during an interview that would just kind of maybe cause your antenna to go up a little bit?
I think if they start asking too many questions about, you know, how hard they have to work, or how busy the schedule is, or, you know, how many call shifts do they have to do? So
when someone asks you that, what's going through your
mind?
Well,
I'm sort of thinking they're not going to be a team player. You know, I tend to lead by example. I try to participate in, you know, we have to do some weekends here and there. We have to do some overnights. try to make things fair and equal, with my whole group. And I would expect anybody that was coming in to our service to be ready and willing to do, be flexible and do what's needed to keep the service running.
Great. So not knowing your why you're there, asking too many kind of nitty-gritty logistical questions.
Yeah, you want to ask the questions that you want to know what you're getting into, right? And you want to know how the service is run. See if it's a fit with your own personal situation. But you want to also make it known that if you're hired for this position, you're going to be all in. You're going to be ready to do what's necessary.
So Tim, we've been talking about some of the red flags, things that happen during an interview that might cause you kind of caution or take a pause. But what are some of the green flags, some of the good things that make you feel confident to kind of go ahead and pursue a candidate?
Well, aside from experience, which, a lot of people don't have yet, I think, if you can demonstrate that you've had some leadership roles in the past, that's always a great thing to see, either membership in an organization or there are PA student organizations, both within the state and at the national level. Those are nice things to see. Presentations, some programs give PA students opportunities to present either thesis ideas or thesis papers. That always shows, I think, extra initiative, especially if it's optional.
How can if you're a student and you're putting some of those things on your resume and you got the interview, so you're in that process, when's like a natural point in the interview to kind of bring some of those things forward? Maybe I think a lot of students will feel like, well, I can't lead this interview, but I have these like other valuable things that I should be bringing forward. How can you do that during an interview?
Well, I think one of the main questions you would be asked as a new graduate was, tell me about PA school. And I would leave it an open-ended question. What was your experience like? What types of rotations did you love? Was there anything that you didn't like? And then what other experiences were you able to acquire during those couple of years? And that's an opportunity to really, talk about your accomplishments. And, a lot of people don't want to sound cocky, so to speak, but you have to walk that line of touting your own accomplishments without being, overconfident sounding. So, I think that's a great opportunity to say, I really enjoyed this and I had the opportunity to do these things, just to kind of highlight some additional skills outside your, basic medical knowledge and experiences that kind of everyone gets in PA school. And
so what's going through your mind when you have a candidate bringing forward those great examples? What are you thinking?
I'm just thinking that this person is again a go-getter. They would be a good team player. They're willing to do the extra work. And when you're a new graduate and you're in a new job, you need to be prepared to do the extra work. So I'm looking for indications that they have the right attitude.
So Tim, you said a little while ago, obviously in your program you're hiring mostly experienced cardiothoracic PAs, but I know that there's a ton of students out there that dream about that and breaking in to this really kind of highly coveted specialty. So tell us a little bit about how you were able to break in and what other students could be doing to kind of give themselves that shot, that opportunity.
Yeah, there are plenty of opportunities. There really are. It's a very specialized field, and it requires a level of intensity that's different from a lot of other medical specialties. But it's a big field for PAs. It's a specialty of surgery that is very, there are a lot of job opportunities simply because there aren't as many residents in training to, participate in those teams, which are essential.
How do you access those opportunities?
Yeah, it starts with, looking at the right places. Again, a bigger surgical program will need more physical people to run the show. And those services typically are established. They have a team in place, and they're not going to hire a whole team of new graduates, but they have the manpower to do the training that's necessary to bring someone new on board. So that's where I would start is with those types of programs, university programs, bigger hospitals that are doing lots of surgeries. Those places have the capabilities of bringing a new person on and doing that training.
What can you do to stand out as a new grad candidate for getting into a cardiothoracic program?
Well, just showing that you have the sort of mental strength to participate in intense surgeries like that in the operating room. And that really starts with just the interest, right? Mm-hmm. I'm looking for someone who's passionate about being in the operating room, about doing high level care in the intensive care unit, and that it's a real certain type of person that's interested in that kind of thing.
So, but you're an amazing success story. How did you do it? What was your personal journey?
Well, thank you
into...
for that. I'm one in many that
there's not an abundant chiefs of cardiothoracic surgery PAs in the United States. I mean, you're in a select group.
Yeah.
How'd you break in?
So I went to the LPA program, and I'm from here in Connecticut, so it was a perfect fit for me. I was very excited to have that opportunity, and I think during your clinical year, aside from figuring out what you like and what you don't like, it's very important to look for relationships, foster professional relationships, whether it's a nurse on the unit or a surgeon in the OR or, other students, really. You want to look for opportunities, and many times you'll get lucky. I feel like I got lucky because I knew I wanted to stay local, and that certainly helps.
So what happened? What was that kind of luck? Was there a lucky moment or that moment where?
There absolutely was. I did a rotation in cardiothoracic surgery. It was one of my, those electives are usually toward the end of PA school because you have to go through all your requirements first. And, I made that month, the best I could. And I tried to make a good impression with everybody that I met and everybody I worked with. And I wasn't at Yale for that rotation, but I got the opportunity to work with a surgeon who did work at Yale. And he said, I think they're looking for a PA over there. And it was literally one of those situations where just trying to make a good impression and being eager, even though, I'm not super involved in the actual patient care or doing the surgery, but I showed that I was interested and eager and excited about a field, and he referred me over personally to the chief at that hospital, and that's really how I got my foot in the door in terms of my first time.
Why do you love cardiology? What kind of sparked that interest for you?
The heart physiology is just everything is so. It's so clear. There are equations that you can look at for the cardiac output is what it is because of the heart rate and the volume of blood coming out of the heart. And there are so many things within that you can manipulate to sort of maximize a patient's heart function. And you can see it so clearly when you're using so many different medications or different strategies with treating patients in the ICU. It's just exciting to see an intervention that's very specific work and change for the better what you're trying to change. So
it's a complex process, but yet there are certain, like you said, equations and stuff, so you kind of know you're on the right track
Yeah,
in terms of...
it just makes sense. And maybe I'm a little bit biased, and maybe my brain is, trained to make sense of those things. But when I was in school, it made sense to me. And like I said, I did a cardiology rotation kind of early on in the clinical year, and it just made sense. Electrical conduction of the heart and the filling and the medications you can use, the disease processes, they just made sense to me. And
what else makes you a great cardiothoracic PA? You told us a couple of things, but what makes you a great, and what made you, rise to the chief level? What do you have that makes you so successful in what you do?
Well, again, so my field, cardiothoracic surgery, combines that heart physiology with the technical operating room situation. And I also loved that. I loved being hands-on. I loved being in the operating room. It's exciting.
Tell me,
dramatic.
I got to stop you because you have to tell me about those experiences. What was your first experience like when you were holding that scalpel? You knew you were going to cut into someone the first time. What are you thinking?
It's your heart is racing. It's exciting. It's scary.
Right.
But you're in training. I treated my first few years as if I was a resident, learning, a surgical resident.
So you were already a PA.
I had guidance. Mm-hmm. People showing me how things work and what to do in the operating room. So it is intense. It takes some getting used to. We take it for granted now. It's kind of like we do these amazing things in the operating room that someone, coming to see for the first time is like, that is the coolest thing I've ever seen. And it's kind of like, oh, well, that's just what we do every day. Mm-hmm. But, starting off, the key is to have a person you trust that is sort of guiding you through that.
What happens, when something goes wrong during a surgery, right? You're all planned, you've got your equations, you know what a good outcome's going to look like, but what happens when, it's the human body, things happen. What happens with then?
One surgeon I worked with used to say that cardiac surgery is 99% routine and 1% sheer terror.
Tell me
because
about that.
When something can go wrong, it can go wrong very quickly.
Tell me a story.
Well, so there was a patient who, was on the heart-lung machine, and if the heart is not draining properly, like the heart-lung machine is not pulling blood from the patient to the machine to then circulate back, basically the whole circulatory system shuts down. So there was a problem where the venous cannula, the line draining the blood to the heart-lung machine, all of a sudden wasn't working. It wasn't draining properly. The patient wasn't getting any circulation, and we had to very quickly troubleshoot that and remove that cannula and place a new one in, and this all has to happen within 30 seconds to figure out what the problem is and fix it.
Who's the person on the team when you're in the OR like that makes that call? Like, yeah, now we have to move in a different direction to ameliorate a problem.
Well, so as a PA, I work across from the surgeon. So, the surgeon is there during those critical times, which takes a little bit of pressure off me. But the pressure on my side is I need to help him or her do whatever is needed to fix the situation. So if it's a technical problem that we need to remedy, I have to know the moves that are necessary to either make it happen or be able to expose something properly for him to do what he needs to do.
So is how do I express this? So when that's happening in the OR, is the mood, is the energy more elevated, or do you feel like people kind of just focus in and like there's a different kind of sense of what's happening?
Yeah, both. Everybody there are two types of surgeries. There are the easy routine ones, and there are the difficult ones. And if it's a difficult case, number one, yes, the room has a different feel to it. Everybody needs to be a little bit more focused. But as the first assistant, I also have to do my best to make things easier. I have to anticipate what the next steps are going to be. I have to anticipate what could potentially go wrong here. Then what would I do? The surgeon will be able to act quickly, and I need to be able to keep up.
What's going through your mind at that point? Like, what are you thinking to yourself?
As a new PA, it's overwhelming. It takes years of getting comfortable doing the easy cases for you then to be able to do what's necessary in the difficult cases. So typically, as a new student or as a new PA, you're going to be in those easier cases. You're not going to be thrown into some complicated aortic surgery in your first couple of years without someone sort of holding your hand a little bit. But those emergencies can come up in easy cases too. So those are scary times, and you just have to perform the best you can.
So Tim, we're going to spend some time talking about what not to do when you get your first job as a PA.
Yeah.
Let's chat a little bit about, okay, so you've interviewed, you've brought that person on board, they've made it through credentialing, they finally arrive, and you got that first couple of months, that kind of honeymoon phase. Tell me what, in your experience, what should PAs not be doing during that time?
It's sounds kind of obvious, but don't be lazy. You want to be as ready and willing to do everything you can to learn your new profession. This is your opportunity to sort of really get into the patient side of things. You have that huge base of medical knowledge now. You want to get out there and you want to do, and you need help doing that. So you want to take the opportunities. You want to, be eager to do new things. If I were a new student, I wouldn't, hide behind someone else and let someone, get that opportunity. I would be the one to say, hey, can you teach me how to do that?
What does lazy look like?
Well, I don't know. It's sort of subtle.
You know. What does lazy look like? They want to know.
Not wanting to stay late, not wanting to show up and maybe someone wants to do the bare minimum to get paid. That's not what we're looking for as a team member. Mm-hmm. So,
what else shouldn't they be doing when they first arrive?
I think they shouldn't be. It's hard to have confidence or self-confidence in a brand new situation, but I would say don't be scared to put yourself out there. Try not to hide behind your insecurities. I would say just be confident that you need to learn how to do something and do the best you can, because most, as a leader, I'm not going to let somebody fail. For instance, it's difficult to tackle some situations together, but if you have the mindset that this is something that I can do, this is what I'm excited about doing, you're gonna learn.
What are you thinking when someone comes in and they're not expressing that, showing that they're confident?
Well, I'm wondering if it's the right field. If you're in a very specific field, like one of the surgical subspecialties, and you're either not enjoying yourself or you don't have that sort of drive to learn and succeed, maybe you're in the wrong field, and that happens to people. Sometimes it is a journey. You're not always. It's sort of the beauty of the PA profession overall is you can go into different fields. You don't have to. You're not locked in. So if there was somebody that was not showing those qualities or not telling me that they're excited, right. Maybe you should try something else.
So we're talking about someone who's coming in that's being underconfident, but what about the person who shows up and they're overconfident?
Yeah, like I said, you do have to know your limitations. And when you're a new graduate, you have a lot of limitations, and you have a lot to learn. So it's a matter of being eager and willing without being overconfident, like I'm going to go throw that chest tube in, and that's not how it works.
What'll that look like if someone's being overconfident? What are they doing?
I think getting in too deep. I mean, God forbid you have a bad patient outcome because of it. Mm-hmm. And the experienced PAs have to recognize that, right. and I would have to intervene before something happens, right? What? So if someone, they think they know how to treat this particular patient, but maybe their thinking isn't quite where it needs to be, or maybe they're looking at it the wrong way, that's a learning opportunity. So it's something that can be used to create a positive. But if that's a routine and, they think that they know the better way, that's, maybe it's not a good fit.
What's the team thinking when that PA shows up and they're overconfident?
They're probably thinking, well, they're going to learn. But, if the other part of it is the one thing you do want to do, we're talking about, do's and don'ts, but you want to be helpful to your teammates. Everybody knows you're not fully functional. You're not going to be able to do everything on your own yet, but you can be helpful while you're learning. And that can be, writing that consult note that, one of your team members is overwhelmed with other responsibilities, can't get to. Hey, let me take care of that for you. Something as simple as that can go a long way to telling another person or the rest of the team, you know what, this person's willing to chip in and do what's needed.
Mm-hmm. What other things come up for you when you think about, and maybe a specific story would be a great option, but someone that's coming in and they're doing everything wrong?
Well, you sort of have to have an intervention, right? I mean, if
I don't know. What does that look like? What's an intervention look like?
Well, it would be kind of a formal sit down to say, here's where you started, here's where you are, these are the things you are doing right, these are the things we need to work on. And I think that's pretty standard for any new hire, whether you're experienced or you're not experienced. You have that evaluation period. And after 3 months or 6 months, you need to, I think, intervene early to correct certain things that might be correctable. And as long as you, as the new hire, are willing to be receptive to that sort of constructive criticism, or let's think about things this way instead of your own way, I think you can certainly still succeed.
And so what are some of the other things that you want to see that new hire, that person that are going to be investing that time and effort and energy? What do you want to see them doing when they get to you the first, day, couple of weeks, couple of months?
Aside from having the right attitude, I want to see them practicing, getting in there, getting their hands dirty a little bit, doing as much in the operating room as will be allowed, and just taking things home with them, going home and reviewing, coming in if something's been corrected on one day, say, hey, this, you need to work on this a little bit. Come back the next day and show that you're working. You're doing the homework.
I know you mentioned, even just pitching in to, help out with a chart note can go a long way with telling that other member of the team that you're for real and you're ready to do what you need to do. Any other little tricks of the trade or things that you've seen over the years that, maybe a little thing that's gone a long way?
Well, sort of along the same lines, say you're not very good at suturing, which is a big part of surgery, obviously. And you want it, all the patient sees when you're done is that little incision, right? So you want it to look perfect. It's something that takes some practice. Sometimes you're closing an incision, you're taking it out, and you're going to start again because it doesn't look right. But that outside of the OR practicing, whether it's on, we tend to use, we'll take some needles and a needle driver from the operating room, and we'll practice, sewing 2 towels together in a nice line. Or in PA school, we actually used to use chicken thighs, that you buy at the grocery store, and you practice you make an incision and you practice closing it. It's not ideal. Doesn't really mimic human skin very well, but it's practice. And the same thing with basic things in the operating room, like tying knots. You have to be proficient at doing these things if you want to be the one in the operating room who's working across from the surgeon, doing what needs to be done. You need to be these are basic things you need to just be comfortable with. So taking those things home and coming back the next day saying, look, I practiced this. Maybe you're going to show it in the operating room that day. Maybe you're going to be, tying knots on a pencil or something in the office, but show that you're willing to do the work.
What are you thinking about that new PA that maybe doesn't have the best suturing skills, and then they come in and you can see that they've been perfecting their art?
Yeah, I mean, when someone is excited about what they're doing and eager to learn, and it's fun to teach them, right? It's the same thing with students. As a student, you should be excited about whatever field you're doing that rotation in. You may hate it, but you should pretend that you like it because it's just more fun to teach somebody who's excited about what they're doing. And hopefully, if you're taking a job, this could be for the next however many years you're going to be working in this particular environment. Hopefully, you are excited and you do enjoy it. But it's just so much more fun as a mentor to teach someone who's both receptive and excited and comes back and you see, wow, that's great. You learned.
So Tim, one last question. I'm your Genie, and I have the ability to really take you back in time to that impressionable time when you were in PA school. You've had all this experience. You've been in a leadership position for years at this point. What would you tell yourself if I could bring you back there that would have made all the difference in this journey you've been on?
I think when you first start out, there's a level of stress and anxiety with treating patients who are, human beings, and you're put out into the world and you have to, deal with these life and death situations. And, you don't have that confidence of experience that gives you. And I think I would go back and tell myself, just stay the course, keep in mind where your goals are, and everything will fall into place if you do the hard work. And if I had just been able to take that step back and sort of realize, I'm in the field I want to be in, I'm excited about my job, I'm passionate about, where I've come and where I'm heading, everything will kind of fall into place if I just keep it in perspective and work hard.
Awesome. So thank you, Tim. It's been a great time, and we will see you again next time.
Thank you.